Yat welcome to 4 Directions of Wellness. I'm Roberta Diswood. Twobahanishla, Sisakani Bashichin, Nakaidine Dashiche Hanani Dashinele. Sexually transmitted infections are at an all-time high. Last year, there were a record 700 cases of syphilis across the Navajo Nation. STD prevention is critical and can be as easy as talk, test, treat. With us today is Justine Yazzie with the Navajo Nation HIV Prevention Program and Michaela King with the Navajo Nation Health Education Program. I want to thank you guys both for being here. Can you go tell us a little bit about yourself?
Yeah, good morning, Roberta. My name is Justine Yazzie. I'm the HIV Health Educator with the Navajo HIV Prevention Program for Shiprock Service Area.
Thank you. And Michaela?
Good morning. My name is Michaela King, and I am the Health Education Technician with the Health Education Program.
Again, I want to thank you guys both for being here today. The CDC has data from 2020 that shows syphilis in the United States has increased by 52% since 2016. And congenital syphilis, which is a syphilis in the developing baby, has increased by 235%. What needs to be done to reverse this situation?
We would like to talk about the Talk, Test, Treat, which is a CDC campaign that encourages individuals and healthcare providers to take 3 simple steps: talk, test, and treat. It's critical that we talk about our sexual health with our partners and doctors. You know, everyone who is sexually active should get tested, and if you do test positive, work with your doctors for treatment.
Talking about our sexual health can be uncomfortable and even embarrassing for some people. How can we encourage people to talk about it?
So we can be open and honest with our partners and healthcare providers about our sexual health, and then talk about when the last time you were tested and suggest getting tested together. And talk before you have sex, show that you care, share the facts, and agree to stay safe.
Okay, that's really good. Thank you. And so where can people go to get tested?
So again, the only way to know your STD status is to get tested. People can go to the local IHS clinic or hospital. They can talk privately with their doctor to get tested. But you know, if they're not really comfortable, they can look up a local STD clinic or program that offers free testing or low-cost testing. But it's really important that they should include that in their annual wellness exam to get STD tested.
Okay, and that's good to know. So if someone tests positive with an STD, what sort of treatment will they receive?
Okay, so when somebody tests positive for an STD, they need to work with their healthcare provider to get the correct treatment. All STDs are treatable, but there's some STDs that are only manageable, like HIV. Patients need to complete their medication that they were prescribed. It's best not to share their medication, and to always follow up with their doctor and to get tested again.
Okay. And so that's really good information to make sure that we remind people about. Congenital syphilis, which is syphilis in newborns, is very high. Can you explain how congenital transmission happens and maybe the importance of prenatal screening?
Yeah, so congenital syphilis is a disease where a mother with syphilis passes it on to their babies during pregnancy. For children, it can cause low birth weight, miscarriage, stillbirth. So it's really important for women to get tested and screened. It's recommended that pregnant women get tested at their first prenatal visit. And depending on, you know, the rates of syphilis in their areas, it's important for women to probably get tested a little bit more often, you know, their 3rd trimester and then when they're born.
So we don't want to end the show without talking about prevention and also about protection. So how can we prevent getting a sexually transmitted infection?
Yes, by practicing abstinence, which means, you know, not having sex, using condoms for those who are sexually active, establishing a one-partner relationship after both people have tested negative, and talking with your partner about your sexual health and STDs, and also getting tested.
So you both talked about prevention. Can you tell me a little bit more about how your program is helping with that?
Yeah, so with our HIV prevention program, we offer HIV, AIDS, and STI prevention education. We do presentations to communities, work sites, schools, and to patients. We also offer free condoms at our office, so anybody can stop by to pick some up, or if chapters like recommend it or other programs, we can deliver some to them. We do also do just HIV testing strictly, but due to the pandemic, we haven't been able to do that, so hopefully get that rolling this year. But those are the majority of what we do. Our health education program also touches on STIs. They can do presentations. So that's how we can cater to the community to get that word out about STIs.
Okay. Well, I want to thank you, Justine, and I want to thank you, Michaela, for being here today. This has been 4 Directions of Wellness. Hogo Net.